Stop ignoring these growths, and here's what you need to know instead. This is by far one of the most requested treatments by my darker skin tone individuals. They are wondering why they're getting these small lesions that keep popping up on their face, their neck, their chest area, and they're like, what is going on? Because every time they look in the mirror, they see more and more as they start to mature. So of course they go to Dr. Google, and then Dr. Google says, you have cancer, and then you say to yourself, WTF, I need to go and see my dermatologist. I wish more people knew that seborrheic keratosis and dermatosis papulosa nigra are benign lesions. They are not due to improper skincare, and the wrong removal method can actually cause scarring and hyperpigmentation. This may be a little controversial, but not all removal methods are safe in darker skin tones. So today I'm going to break it down. What are seborrheic keratosis versus dermatosis papulosa nigra? Who gets them? And what are the treatment options available to you? Hi, my name is Dr. Naana Boakye. I'm a board-certified dermatologist, and if you're new here, welcome. I break down skin health in a way that is understood and backed by science. So what are seborrheic keratoses? Seborrheic keratoses are classified as these warty growths that are stuck on, that could pop up anywhere. They could appear on your scalp, your face, your chest, your back. Sometimes we even see them in the groin area, and they're due to an abnormal growth of skin cells. These lesions are harmless, they are not contagious, but as you mature, you definitely see a lot more. So who gets them? Guess what? If your parents have them, you're gonna get them. I tend to see seborrheic keratoses in patients who are in their 30s and 40s, and obviously older individuals. And over time, they just get thicker and thicker. On lighter skin individuals, sometimes they could appear white or tan. And on darker skin individuals, they could appear like chocolate to black. There are various types of seborrheic keratoses. You could have the acanthotic type, you could have the verrucous type, and then you could have what we call dermatosis papulosa nigra. So what is a dermatosis papulosa nigra? These lesions tend to be tiny and more waxy and tend to occur more on the face, the neck, as well as the chest area. I tend to see them more in Black patients, Asians, as well as Latinas. So what's the difference between a seborrheic keratosis versus a dermatosis papulosa nigra? It really comes down to size. DPNs tend to be smaller than SKs, which tend to be a little bit larger. DPNs mostly appear on their face as well as their neck area. And again, as I just said, DPNs occur more in Blacks, Hispanics, as well as Latinas. I tend to call DPNs chocolate chips, preferably with 70% cocoa. So again, who gets DPNs? Genetics plays definitely a factor. So if your parents have them, you're definitely going to get them. I have seen them appear more in patients who are in their late teens, and then obviously they get into their adulthood, and they do tend to get bigger during pregnancy. And again, because DPNs are just variants of seborrheic keratosis, a common symptom that most patients say is that they tend to be itchy and sometimes can be really irritating. So the truth about removal, you don't have to remove them because these are benign and they're harmless. And if you use any acids at home, guess what? You're doing more damage to your skin. And honestly, these are just cosmetically not elegant, and we have treatment options in the office. So what are those treatment options? Cryotherapy is just a form of dry ice, and we tend to use it more for seborrheic keratosis. And what can happen is that it can cause discoloration, especially in darker skin tones. It can cause a little bit of what we call hypopigmentation. Electrocautery is actually one of my favorite procedures. I love doing that on my melanated individuals. If not done properly, it can cause hyperpigmentation. Laser procedures are also a fantastic option. We have various types. We have CO2 laser, we also have erbium, KTP, Nd:YAG laser, can be done on all skin types. Again, if not done properly, it can cause hypopigmentation, even hyperpigmentation. And lastly, it can be a little bit more expensive. We also have what we call curettage, where we go ahead and we scrape or remove those thicker lesions for those seborrheic keratosis. It's a great, easy way. I wouldn't opt for curettage all the time because you could potentially cause a little bit of hypopigmentation if you go too deep in the skin. And then lastly, we have our scissor technique for those lesions that look like a mushroom. That's a great option. We wouldn't do that for all lesions, but it's just good to have different treatment modalities for different presentations of these lesions. So remember, DPNs and seborrheic keratoses all occur in the epidermis. And if you really want to do a deep dive and learn more about the epidermis, check out my Hillman talk on TikTok at Dr. Naana Boakye. I'm doing a 12-week series all about the epidermis, and I provide a lot of practical tips just so you can keep your barrier healthy. In addition to doing removals, we can also apply topical treatments to these lesions. So for example, we can use something called cantharidin. Cantharidin is actually classically used for like warts as well as molluscum, but they can be used for either seborrheic keratosis or dermatosis papulosa nigra. The way cantharidin works is that we apply this liquid to the lesion and it causes what we call an intraepidermal vesiculation. So basically a fancy name for a blister. But I personally don't like to have a blister on my neck. That can be very uncomfortable, and you don't want any blistering on your face. And most of the time when patients come to me, they have like hundreds of these seborrheic keratoses or DPNs. So you can imagine it's really not ideal to have hundreds of blisters, and then even though the blisters are tiny on your neck, it's just very uncomfortable. So it's not one of my favorite options to do cantharidin treatment. In addition to cantharidin, the FDA recently approved HP40 or hydrogen peroxide 40%. And the way this works is that you apply this hydrogen peroxide 40% onto the lesion. It creates this oxygenation in the epidermis, which is toxic to the keratinocytes and not necessarily the melanocytes, and then that's how these lesions tend to fall off. So this could be another option if you didn't want to use cantharidin, to go ahead and use this hydrogen peroxide 40%. Trichloroacetic acid at 65% is also another option that can be used in the office to go ahead and remove these lesions. So which one's best for you? It's really important to have that consultation with your dermatologist to discuss how many lesions you have, where they're located, your skin type, and the best treatment option for you. And talk about with your dermatologist when to follow up. I always stress that with all my patients. I want to see you back in about 3 to 4 weeks. 1, to make sure you're happy, and 2, to make sure those guys fell off. So for instance, I just had a patient, she's 5 months pregnant and she's African American, and she's like, listen, doc, what would be the best way to remove all of these lesions? Number 1, I told her, listen, you're pregnant, you're going to get more. Do you necessarily want to do this now? And she said to me, well, you know what, I do. So we said, well, you know what, why don't we just go ahead and do electrocautery, because it's safe for you, it's safe for in pregnancy, and we'll go ahead and do that rather than doing some of the other procedures. And she agreed upon it. So let's go through some myths and versus FAQs. Are seborrheic keratosis and DPNs contagious? As you are aware, they are not contagious, nothing to worry about. They are safe. It's safe to rub up on an individual if they have them. Are they due to a bad skincare routine? Obviously not. These are tiny, harmless lesions that are not due to your skincare routine. Removing them does not make them grow back. Remember, these are all due to genetics. You will get more over time. And normally what I do tell my patients is that, listen, if I remove them now, I'll probably see you back in about 3 to 5 years to remove more. So it's worthwhile to remove them. If you have seborrheic keratosis or dermatosis papulosa nigra, remember these are harmless, tiny lesions that are not contagious and really nothing to worry about. You actually do not have to have them removed. But I can tell you that those who do remove them, they are really ecstatic about the results. So go ahead and have that conversation with your dermatologist about whether it makes sense to remove them. If you found this video helpful, please like, subscribe, and comment below. I cannot wait to hear from you. And if you want to hear any other topics that are related to skin or wellness, please let me know.